Hello and welcome to PhysioJo's Health Info. Today I'm coming at you from my kitchen and we're going to talk about injury / pain and what happens to our body when we injure ourselves. So first things first, most injuries, although they can be very, very, very painful, occur when any kind of soft tissue gets injured. So we all know about broken bones. Those of us that have had them, it's pretty painful. A lot of people have experienced nerve injuries. So when a nerve is injured, whether it's being compressed or it's irritated by something, the symptoms that you're going to have are a combination of pain, numbness, and tingling, and it usually spreads. So from wherever the nerve is getting compressed, from that point down to wherever that nerve goes, that's where you're going to feel those symptoms. And when it comes to nerve pain, every nerve in your body is mapped out. We already know where they go. So if you wanted to know specifically, there's a map actually of the human body and every nerve, what part of the skin it innervates. So numbness and tingling, you'll know where those certain areas are if you study exactly where that nerve goes. And then same thing, the nerve roots in the neck. But we'll talk more about the nerve roots when we talk about back pain, which is going to come in one of my upcoming videos. So soft tissue pain. So pain in general, most of the time it's going to be soft tissue that gets injured more than not. We could have fractured bones, dislocations, things like that. But a dislocation, just like a sprain, is going to be an injury of the tissue that holds the two bones together. The one bone comes out of the socket, goes back in. It's not the actual bone itself that was injured. It's everything that holds those two bones together. So let's keep it simple. We're going to talk about a muscle strain. So you injured a muscle or you injured a ligament. First off, let's just break down our terminology so everybody knows, we all know what we're talking about. The job of a muscle is to move a bone, right? So you've got your bicep muscle here. You contract it. So every time you contract a muscle, it shortens. You're going to contract it. It's going to bring your arm up. So you're bending the elbow. So the job of a muscle is to move a bone. Tendons are part of the muscle. It's more like the rope part. So if you move your hands like this, you see these ropes that are on the back of your hand. Those are the tendons of the finger extensors. So the muscle itself, the bulk of the muscle's in here, and it comes down as these ropes that attach to the bones, and it will move the bones that way. That's what a tendon is. Ligaments are what holds the bones together. So it's a tissue that doesn't have much stretch to it. They're designed to be pretty tough and difficult to stretch, but they're not easy, but they are commonly sprained. I'll give you an example of an ankle. Ankles are probably ligaments are probably and the knees are two of the most common groups of ligaments that get sprained from, and it's usually athletes that experience that. So the purpose or the job of a ligament is to hold two bones together. If you forcefully push one bone beyond the other further than that ligament can retain it, which is its job, that's where you're going to damage that ligament. That's how you're going to sprain that ligament, because it was pushed a little bit further than it naturally goes. So that, in a nutshell, you got muscles, tendons, ligaments. Capsule is another soft tissue that we talk about, mostly in the shoulder. People have frozen shoulders. It's a problem with the capsule. So the capsule is like a sack, like a saran wrap, we'll say, that goes around the joints. So the joints are anywhere two bones come together, and that's where the movement is. So you've got them all over the place, in the shoulder, in the hip, in the knee. So anywhere you've got movement is the joint. Every joint is surrounded by a capsule. So the job of the capsule is to contain the synovial fluid that's in there. So the synovial fluid will allow for those two bones to kind of rub or move smoothly one on top of the other. Kind of like oil in a vehicle. You need synovial fluid in there to make sure that things don't get stuck. The job of the capsule is to hold all that there. What happens with a frozen shoulder is there's inflammation within that joint, within the capsule, whether it be from trauma or it could be just out of the blue, it happens and nobody can really explain what happened. The capsule swells because of the inflammation, and when the swelling goes away, the capsule ends up getting like shrinking and getting stuck to the bones. So we call it, that's why we call it adhesive capsulitis. So the capsule got inflamed and now it's stuck to those bones and it's not allowing the bone to move the way it's supposed to. Cartilage, that's another thing we can talk about. So what is the most common diagnosis or thing or condition that people can have that's related to cartilage and that's painful? Osteoarthritis. Yes. So cartilage is on the end of all the bones that come together and touch. Okay. So if we're talking about your knee, the knee comes down as the thigh, and then there's two balls at the end. There's cartilage on the tip of that bone. And then your tibia, so the leg part, is more like a cup, and that's where the femur will sit in. On the top of this one, you've got cartilage as well. And in the knee, we've got those special discs that help absorb the shock, which is the meniscus. But remember that the cartilage is at the end of all of those bones where they come together. Our weight-bearing bones or joints, which are ankle, hips, knees, and in the pelvis, mostly we're going to talk more than the hips and the knees. Those are our major weight-bearing joints. Those are the ones that there's probably a higher percentage of people that develop arthritis in those joints than anywhere else. Those ones there, when the cartilage gets worn down, it's going to be rough. It's not as smooth as it was before. So our normal cartilage is nice and smooth. And when you bend and straighten your knee, you don't hear anything and you don't feel anything. When your cartilage has been worn down and it's more rough and looks like there could be like little holes in there, if you see on a diagram, then you've got arthritis. And there's different degrees of arthritis: mild, moderate, severe. And that's what's painful. When that cartilage is worn down and now you have the bone that's exposed, that can be quite painful, especially when you're standing and walking, because that's what those joints are designed to do, to bear weight. So in a nutshell, I think I covered most of the definitions, I guess, of terms of different parts of our body that could be injured. Now let's move on to pain and injury. So what happens when you injure one of these soft tissues? We'll use a muscle or ligament as an example. You sprain or strain muscle or ligament, what's going to happen? Using an ankle sprain as an example. If you sprain your ankle, you're still going to, you could still walk on it. You could still put weight on it, but it really hurts. So you're going to change the way you do things. You're going to compensate for that pain to be able to still do your everyday activities. So you're going to limp. That's what limping is. Limping is a way to get off of that sore foot because it hurts too much when you put all your weight on it. Another example would be neck pain. So let's say you slept wrong the night before, you had a new pillow, you wake up and you got like a kink in your neck, so that every time you turn your head to the side, when you get to that point, it hurts. So what you're going to do is avoid turning to or beyond that point because it's going to hurt you. So you're going to compensate and turn your body this way as opposed to turning your head all the way. This is the equivalent of a limp if we're talking about the injury in your ankle. Why do we do that? Well, one, we have to still function. You have to still be able to do your everyday activities, and that's how you're going to do it, by compensating. Our body wants us to compensate, or is going to cheat by using other muscles to get the job done in order for that injured tissue to heal. If you don't let it heal, it's not ever going to get better. And the only way you're going to be able to let it heal is by giving it a break and allowing it to not be exerted or pushed or used too much. Unfortunately, you can't just lay in bed all day for 6 weeks, which sometimes that's how long it takes for soft tissue to heal, is 4 to 6 weeks. You can't do that. You got to keep moving. You're going to end up with even more problems if you were to do that anyhow. So your body has adapted by being able to recruit other muscles to get the job done. Now, where that will lead to issues is that you're compensating with muscles that are not designed to do that certain job. You do that for 4 to 6 weeks. So one muscle is going to compensate for the other. When this other guy, when the injured one gets weak, oftentimes your brain doesn't realize that that one is healed because you've kind of learned how to not use it so much anymore by limping or by changing the way you do things, that your brain doesn't know to stop using the one that's been compensating for and get back into using this one that was supposed to be doing it in the first place. And that's where we fall into a lot of muscle imbalances or asymmetries. So our body likes to be aligned. It will work at its best when it's aligned. So if we go back to the example of knee arthritis, because we talked a bit when we were describing the cartilage and what arthritis is. If you were to stand, just to stand up, actually I'll put it this way. Think of your skeleton, think of your body without skin, muscles, fatty tissue, all the soft tissue, take all that off and just think of the skeleton itself. Our skeleton is designed to be able to stand on its own without any forces, without anything kind of influencing it. It's designed to stand on its own. So our joints are made to sit nicely one on top of the other so it can stay standing. Especially if we're talking the weight-bearing joints. Arms is different because all the bones are going to fall on the ground. So if you were able to use your body in a way where you are allowing your joints to move the way they were positioned to move, if you think of the skeleton on its own, and the way a joint is supposed to go through its range of motion from one end to the other, without any abnormal external forces like gravity, like muscle imbalances following an injury, your joints would be happy. There would be no issues, there would be no problems. But as soon as you throw in something that's throwing the alignment of your body off, that's where you're going to come in. You're going to run into some problems. And a lot of people who develop knee or hip arthritis, when I talk to them, I ask them about injuries in the past. And I'm talking going back 10, 20 years. Most people that I see who have had knee or hip replacements, or they have arthritis and they're getting ready for potential surgery, they're in their 60s and 70s and sometimes in their 80s. So we're talking injury that happened, could be 30, 40 years ago, that their initial injury happened. If you hurt your back or you sprain your ankle, you break your ankle 30, 40 years ago, your body compensated for that injury. If you never worked on getting your body moving the way it's supposed to again, the way it did before your injury, getting rid of all those muscle imbalances that built up, you will be eventually, like 30 years later of walking on a limb that's not aligned properly because of these muscle imbalances, will eventually lead to asymmetry to the point where you're going to get wearing down of the cartilage in the knee because the alignment is not there. I'm sure some of you know people who limp and they've been limping for years. I have had patients where they go for hip. I see them before the hip replacement. They come back after and they're doing really well. I get them to walk and I notice that they're limping. So I said, I asked them, do you have any pain? No, I'm fine. It doesn't hurt at all. I said, well, why are you limping? I didn't even realize I was limping. So even though what's neat is the muscle imbalances that lead to the muscle imbalances that happen in our body because we compensate can lead to alignment issues. Our body doesn't like to be in misalignment. It wants everything to be stable and neutral. It wants your shoulders to be level. It wants your pelvis to be level. It doesn't want any rotation in your pelvis. Our body wants that. So anytime that you find yourself out of that position, you've been like that for a long time, you're going to put your body at risk of an injury such as arthritis or other muscle imbalances or other muscle spasms that are going to kick in. So your body goes into spasm, into protection mode to help protect that muscle that was injured. Now, it's going to do that for a while, and then after a while, that muscle that's been compensating for the other one, he just won't be able to do his job anymore. So another muscle imbalance is going to get, or compensation is going to get thrown on top of that. So you're just going to have more and more and more compensations piling up. And that's where one injury, like a back injury from many years ago, can lead to eventually pain in the bum area, pain in the hip, pain in the knee, pain in the opposite shoulder or the neck. And even though people may not think that it's related, once we break it all down and we look at how the person is moving, it's very easy to pinpoint what muscle imbalances exist. And usually it's a certain muscle group that is not doing what it's supposed to do. So we've got weakness in these guys. And then there's usually the opposite muscle group that is working, the opposite muscle group that is weak. So one muscle's weak, so the other one is working too much or working harder to compensate for that one. So you have a definite muscle imbalance there. There's some tightness on the one side. Those of you that have come to see me as patients, I've explained this to you before because it's very, very common in the pelvis. I'll go into a little bit more details about what muscle imbalances we see in the pelvic area that can affect the back, the pelvis, the hip, or the knee. So anybody that comes in with any of those 4 areas that are injured, as a physiotherapist, I will assess posture first. I want to see how you're standing. How does your body look? Are there asymmetries? If your shoulder, one of them's higher than the other, if your head is tilted to the one side, you've got one leg longer than the other. Your pelvis is either like this or tilted more forward and back than it's supposed to. If you have one leg that the knee's in hyperextension instead of being both naturally just bent a little bit, that tells me a lot about what's going on in your body. From there, I'll watch you walk. Watching people walk is a passion of mine. I just love to watch people, and if I see anybody who's limping or their gait is off a bit, I try to figure out what the problem is. And most of the time, I can pick out what side is the issue, like left or right, hip or knee, or if it's someone who's had a stroke in the past, I can tell that type of gait pattern. So we look at posture, we look at how people are walking. Are there any muscles that just are not there anymore? That I'm looking at you and I can tell that you've developed a lot of atrophy. So that's wasting of a muscle because of inactivity or not using it. We'll talk about that next time too when we talk about the back pain. And then checking strength and range of motion, flexibility of muscle. So those are all things. All of this to say, if you have a lot of pain, it's gotten to the point where it's chronic, you think that it might be due to something other than the area itself. So you've got arthritis in your knee, but you don't really think that you did anything to your knee itself, but you've had back pain for years. Chances are it's because of the back injury that you had 20, 30 years ago that your knee is worn down and is the way that it is today. So all of this to say, pain is tricky. It's tricky, but it isn't. If you can figure out what muscles are at fault, who's compensating for who, and where the original injury lies. So the key to finding out about chronic pain, who's causing it, where it comes from, is to look at the big picture. Look at the person as a whole, try and figure out where the original injury came from, and then from there, we put an exercise program together to try and get people back on track. So that's my spiel about pain. And in one of the next videos coming soon, I will discuss chronic low back pain, and we're going to go into some specific muscle imbalances that occur. So if you do have back pain, or you had back pain in the past, and you think it might have something to do with your hip or your knee that are not feeling all that great, we're going to talk about that in that session. So you might want to tune in for that one where we're talking about chronic back pain. So for today, I hope it wasn't too confusing. I know I bounced around all over the place, but basically pain, anytime you have an injury, your body's going to try and brace and protect it. By going into protection mode, you're going to be using muscles that are not designed to do those specific jobs. And after a while, those compensations, they add up and they pile up, and then you start to have problems elsewhere because too many muscles are helping each other out, which in the long run is not the greatest thing because it's not the way our body was designed. In a nutshell, if you have any questions about this, or you want to know a little bit more, or you want clarity on anything, because I know I can talk a little bit too much sometimes, so I'm already at 20 minutes. So I'm going to say goodbye for now, and I'm going to touch a lot on this again when we talk about chronic back pain. All right, take care, stay safe, keep moving, have fun, bye.